We have one of the lowest uninsured rates in the country. We should be proud of that. We're ranked the healthiest state in the nation in 2019 by the United Health Foundation. And Vermonters generally have good access to primary care. But these good things come at a price for Vermont families, and the increasing cost of this success is not sustainable. That's why I see so much promise in accountable care, to address costs by improving quality and efficiency.
Why does the United States pay so much for health care and get so little health? One of the reasons is the way we pay for health care in this country is broken, and the fee-for-service system, where you only get paid if you do something to someone as a doctor, incentivizes expensive procedures even when they're not necessary. It creates a tug-of-war between insurers and clinicians, and it actually rewards healthcare systems when their population is sicker. So the idea in health is to pay differently, and accountable care organizations are one way for that to execute that vision. In my mind, the most important thing that they can do is change how care is delivered. They can say, you know, we're not paid now by the heart attack and the stroke and the heart operation. We actually have a chance to do things differently, to invest in prevention and still see the benefits.
Much of this effort builds on a long history in Vermont of community efforts to coordinate care. Communities have been, digging in and doing that work on the local level for years and years, and saving a lot of healthcare dollars, not in such a coordinated way.
The providers, the hospitals in Vermont really decided to lead the way and jump into this effort for a pretty simple reason, which is the opportunity to really do what this panel, I think, visually represents, which is to come together as a community of providers and really deliver patient care in a more coordinated and thoughtful way that also keeps people healthy. And ultimately that saves costs, but really, maybe more importantly, it orients our healthcare system to what I think it should be oriented to, which is helping people live longer, healthier, better lives.
We are now seeing hospitals investing in social workers in their emergency rooms. We're seeing them investing behavioral health specialists and nutritionists in their primary care practices. We're seeing hospitals investing in lifestyle medicine specialists, nutrition specialists. We're seeing hospitals enhance their palliative care in their cardiac rehab. We're seeing them investing in housing in their communities. Right? This is a transformation that I've seen over 5 years. And they're realizing that if they're paid differently, and that the goal is to basically align with what patients want, which is lower cost, high quality care, and the incentives are structured that way, the investments are going to be made that way. So seeing those providers start to make those investments gives me hope for the long run.
Now we have the opportunity to care for people the way that we think is best, and that makes the most sense for them and for us as well. And so we've been able to test like amazing innovations that let people get treated in their homes for the longitudinal care project. It allows people to be treated in groups so that they can really build a community around them. And those small tests of change are really what I see as very promising in this effort.
What we know is that actually more touch, more patient human interactions with a nurse, with a community health worker over time at home is keeping people out of the hospital in Chittenden County. And through OneCare, we're actually going to be implementing it all over the state in many of our agencies.
One thing that we've tried is doing a diabetic group visit, and I think hopefully you'll hear from one of our patients, Marie, who's part of our diabetic group.
I really can't say enough about the group. They've really changed the whole picture for me. We bounce ideas off from each other. If somebody's struggling to do something, one of us may say, well, try this. That's helpful. And it's just, we're all in it together. So it's helped us all.
All expenditures in the healthcare system should make the system better for everyone. That is the idea of aligning the different payers, that when Medicaid is paying in a different way, the practice is able to do things differently, and you can get, a diabetes group discussion, and, all patients can benefit. So you have a platform in Vermont for that. It doesn't guarantee results, but it gives you a chance that other states do not have to bring the various resources in healthcare and wind up getting a change that really is good for both costs and health.
We're trying to change a system that has been built over many decades without any plan. And I think true innovation, if you just look at any examples across any environment, any industry, they don't, it doesn't happen all at once. And so
Still, it's pretty nice to get an article saying Vermont had the best outcomes with the states that have done it.
It is. I'm not really sure that many people in Vermont paid attention to it. We saw it. We were very proud of it. We put it out there. But it has been a bit of a challenge to both work on it and then tell the story. So it's great that you're here doing this. Thank you.
We have a responsibility as a Vermont healthcare company to be on a path to affordability on behalf of all of those customers. And we absolutely feel that the all-payer model, the healthcare reforms of Vermont, the integrated system through One Care Vermont is that best path for the state of Vermont.
Well, it was interesting when I remember asking, I think it was Don George, at the last time you spoke, and I said, as an employer, I can't paint One Care because I'm not quite sure as an employer how I fit into it. And Don made it very simple. He said, you may not even notice the difference, except you will end up with healthier employees being taken care of in a better environment. So for me, that was an easy sell.
So I want to mention two challenges. One of them I've already kind of talked a little bit about is scale. It's really important to get enough patients in an accountable care organization so it can transform care. Because otherwise you wind up with the, I couldn't find the 1 foot in 2 canoes. I don't know whether that's a metaphor that really resonates or not, but we use it all the time outside Vermont. If you have 1 foot in each canoe, you're trying to do the old way and the new way at the same time. It can be very hard to transform clinically.
Thank you so much, Dr. Sharfstein. I do want to comment on the use of the foot and 2 canoe metaphor. Those of us that are here and in the North Country, we'd never do that. That's not, to get yourself in that situation is not intelligent. I think more that we're in the parking lot, we're heading up the Burroughs Trail, we're heading towards the top of Camel's Hump, and there's definitely twists and turns in the road. There's in the trail. There's things that we'll discover along the way that we'll stop and we'll look at. But we know that there is a summit and that there is a path and that we're heading up it. And we did have some themes today. Marathon, not a sprint. Incredibly complex. Unbelievably important for us to stay on that path. And in my 40 years in Vermont, the way we solve complex problems is that we get the right people in the room and we hash it out, we keep working on it until we get it right. And I think we owe a real round of applause to folks with a lot of different perspectives on this who spent their time this morning, and all of you the same way. We thank you for coming and being part of this conversation, and we'll keep on that path and we'll keep moving forward. So thank the panel and thank you all.